Good afternoon, everyone, and thank you so much for taking a few minutes to join us this afternoon on what we feel is a very exciting and privileged call, especially given the timing of the season. On behalf of Raleigh Chamber CEO Adrian Cole and myself, John Goodman, VP of Government Affairs, we thank each and every one of you for what you're doing across our area and within your own communities as we as a business community try to navigate challenging, difficult times and lead ourselves to better days, which I think we all feel are coming very soon. Just as a couple of housekeeping notes, the call is being recorded. It will be posted on our website in about 48 hours. You will also receive a follow-up link for this call in a thank you email that you'll receive in a couple of days. Also, once Speaker Moore has concluded his comments, we'll have time for some question and answers. We've got over 400 businesses on the call today. We received a number of pre-submitted questions. We're going to try to make our way through those and, as time allows, open up to others on the call that may have questions that come to them during the speaker's comments. If you have any questions, please use your chat option to send those to Sarita Hargrove, and we'll get those in the mix. And finally, if you did submit a question previously and it pertains to the federal government or to an SBA type question, we at the Chamber will follow up with you on getting an answer to that question. But for today's purposes, we want to focus on the COVID-19 House Select Committee, the working groups that have been meeting for weeks now, and also the upcoming short session of the General Assembly to address the COVID-19 needs. With that, I want to turn the platform over to Mike Munn, who is the chair of the Government Affairs Committee at the Raleigh Chamber, and he will introduce Speaker Moore.
All right, thank you, John, and thanks for your work in getting this set up. Good afternoon, everyone, and as John said, thank you for taking some time to join us, and in particular, thank you, Speaker Moore, for taking this time the day before the General Assembly convenes in the midst of our current situation. We really are fortunate to have this opportunity to be with you. As John said, my name is Mike Munn. I am president and CEO of McAdams. McAdams Company is a civil engineering, land planning, land surveying firm headquartered here in the Raleigh-Durham area with about 280 people with offices in Raleigh, Durham, and Charlotte in the state of North Carolina. I'm also the chair of the Chamber's Government Affairs Committee and a member of the Executive Committee. It truly is a pleasure to be able to introduce Speaker Moore here today and give you a little bit of his bio before he takes the podium per se. So about Mr. Moore, first elected to the General Assembly in 2002, Speaker Tim Moore is currently serving his third term as the presiding officer of the North Carolina House of Representatives. Prior to being selected as Speaker, Mr. Moore served as Rules Chair under the then Speaker Tom Tillis and was instrumental in rewriting many of North Carolina's laws to favor the business community. After becoming Speaker, he's continued his efforts to make North Carolina one of the most business-friendly states in the country, as evidenced by our consistent ranking at the very top of every notable list for business climate. Efforts where Speaker Moore has played key role in helping the business community include transportation and infrastructure reform, regulatory reform, water resource availability, tort reform, workers' compensation reform, unemployment insurance reform, and many others during his tenure. Speaker Moore is a lifelong resident of Kings Mountain, North Carolina. He's a graduate of UNC Chapel Hill, where he graduated in 1992 with a BA in political science. Mr. Moore also has a Juris Doctorate degree from Oklahoma City University School of Law that he received in 1995. So with that, thank you, Speaker Moore, for giving us this time, and we do look forward to hearing some of the priorities that you and your team and all of our legislators have been focusing on as you convene tomorrow in these unique circumstances. Thank you.
Well, thank you for having me today, and I appreciate the business leaders who were on this call as well, taking their time to be a part of it. My hope is through this call to actually give you some meaningful data, not the political talk that a lot of times you get when elected officials talk, but actually give you some hard data and some ideas and kind of give you a roadmap of where I see us going on this here in these next few weeks. But thank you for having me on today. Well, let's just jump right into it. And I do have some slides that are and I won't read the slides verbatim, obviously, but I will point on a couple things. Of course, we come back into session tomorrow for what's called our short session, which generally is where we come in and do a budget adjustment session to what we undertook and what we did in the budget last year. We are operating under what's called a continuing resolution right now because we weren't able to agree upon a final budget that was acceptable to both the House, the Senate, and the governor. And so, but the CR has funded 94% of the government operations, which is why things were moving along quite fine, frankly, before the arrival of the coronavirus. What we're going to do, though, when we come back into session tomorrow, it's going to be a little different. Actually, it's going to be a lot different. We're not going to have the large meetings where we're all in one room together like we normally do. In fact, the building's not even going to be open to the public. It's just going to be for members and staff, and then there'll be credentialed press as well. But the way we're going to be conducting our business will be broadcast live, just as this meeting is today, so that members of the public will know exactly what's happening here. The sessions of the House will be broadcast real time online, as will the committees that are going to be meeting through WebEx or other software where they can meet remotely. So we're going to be operating in this new environment with these protocols to make sure we do so, but we do so safely. So where are we and where were we? Before this pandemic struck, North Carolina was in really some of the best position it had been in decades. Our unemployment was low, taxes, of course, are low, the regulatory environment was very favorable, and North Carolina just had continually topped the charts as a state where businesses wanted to locate and to expand. Well, we had this thing called the coronavirus that's come along and has just rocked everybody's world, from our individual lives to our businesses and, of course, in government. And I think a thing that's important to remember, and I remind myself of this every day, and I remind my colleagues that, this is not just a North Carolina thing. It's not just an American issue. I mean, this is truly a global issue. It's a global issue in the sense that it is obviously a healthcare crisis, but it also is, the longer this goes on, creating an economic crisis that will have repercussions that we're going to feel for a long time, particularly if we don't find a way to get this state reopened for business and this nation reopened for business sooner rather than later. So where are we and where are we preparing for things? We know that right now is a time that we need to make changes in how we're doing things to allow North Carolina to weather this storm and to survive. We've done a number of things already, and we'll be passing the legislation on it in the coming days. One is we're streamlining the process where our folks who are displaced from work can draw unemployment. The process where employers can report that so that we get rid of the bureaucracy there so that folks can get access to those funds sooner rather than later, as opposed to the normal 4 to 6 week wait period that folks are able to get access to their unemployment within a week. We've also, we're going to forgive or waive the unemployment insurance tax that businesses in North Carolina would pay for the first quarter of this year. And so that's going to give some immediate tax relief to these businesses that are being hit hard by this. We're also going to extend any kind of deadlines, licensures, permits, et cetera. Think of anything that you get from government that has an expiration date, that you're supposed to renew it on such and such date. But we're going to go ahead and get all those things extended out at least 90 days, in some cases more, so that you don't have to deal with that. I mean, everything from being with 100 of your closest friends to the local DMV office to get your driver's license renewed, to permitting that you need for your business. Go ahead and just get all that extended out so you don't have to deal with that, and really reduce that burden on individuals and on small business. And also make sure that we're leveraging our great tax policy to allow even continued growth and for us to get through this process. We're also, of course, going to be coming in next week, and we're going to be taking up the COVID-19 relief packages that I'm going to get to in just a moment. As we know, healthcare is on the front line of this, making sure that we have the resources there so that North Carolinians get access to the absolute best care for COVID-19. We've seen how the hospitals and healthcare providers have ramped up to do so. And we've also seen the challenges they're facing by virtue, for example, of not being able to do elective procedures, which under the healthcare funding model is how most of them make a profit, if you will, or at least stay as they don't lose money. And so we're going to make sure we're investing there, that we do so in a robust manner, that we enact funds to stabilize hospitals. And really in our rural areas, they're going to be especially challenged, that we get funds out there to make sure those hospitals are going to be able to weather the storm. We're also going to be investing money in the personal protective equipment and expanding testing, both in terms of the antibody testing, but individual testing on folks who are suspected of having the COVID-19, and then also making sure that we do some population sampling so we can really get some accurate numbers and models to see where this thing goes. We're going to invest and do so with our school of public health at Chapel Hill, with our great medical universities that we have in our state, and partner with them and recognize the resources they have to really help provide that information, that treatment to the folks in our state. We're also looking at what we can do to expand coverage for telehealth. We know that during these times, so many doctor's visits are being done either on a computer like we are, or by virtue of telephone call, so that folks don't have to actually go into a medical facility and subject themselves or others to the risk of the spread of the COVID-19. So we're working on that. And of course, ultimately, we're going to invest our resources at our level with these same institutions for development of improving the efficacies of treatment, and also the development of a vaccine. We're really very lucky that and very blessed that North Carolina and UNC Chapel Hill, Duke University, Wake Forest have all been three schools that have been specifically singled out, even in the national media, as being leaders when it comes to these infectious diseases and epidemiology, and the just absolutely world-class research and treatment that's being done there. So we're going to continue to work on that to make sure that we get these resources where they need to be, and to appropriately invest our funds, particularly the federal funds that are coming in, to get those resources there. The last issue that we're going to be having to deal with in our COVID-19 package will be resolving some of the educational issues. As you know, our kids are not in schools right now. They're not taking classes together. They've transitioned to distance learning and trying to learn this way, which is a new paradigm, particularly as it pertains to K-12. We've seen that on the community college and at the university level that this is adapted much more easily. But I mean, look at the age of children that we cover in our public schools. You're covering everyone from 4-year-old, 5-year-old kids all the way up to adults, 19, 20. I mean, you're just that spread. And how do you have a method in place to deliver the best quality education to all of those age groups through the current system we have that is heavily modeled on having children in a classroom and learning? I'm really particularly concerned about those kids between kindergarten and 5th grade, and where they're really having to learn those core fundamentals that are absolutely critical to their success down the road. Example, we know plenty of data shows that a child who cannot read by the 3rd grade is really at a disadvantage to his or her peers when it comes to their success and graduating high school to college to career. And so we know we need to continue to invest there. But this year, you think about it, these kids haven't been in school all these this last 4 weeks, I guess, and so on through the end of the school year. And so we really have to find a way to make sure that they don't just get pushed on and nobody thinks about it, that we make sure that they get those core skills and that base of knowledge that they need to be successful. So you'll see us investing a lot of funds to see that happens in a number of ways. And so it's required some kind of thinking outside the box to do so. But we have some great ideas out there, and we're looking at that. But again, community colleges, the universities, we know that there's been changes there we've had to adapt to. And what we're seeing is that folks are rising to the challenge, and they recognize the things that we need to do to take care of these children, and as well as our adults who are learning, and provide those sources. One example for kids in school is, we know for a lot of them, the only stable meal or consistent meal they get is when they eat at school. So we've actually ramped up and funded the summer feeding program to make sure that kids, while they're not in school, are also receiving a square meal every day. So a number of things along those lines. And I'm going to go through the slides, and then I want to get into some of the real meat that I can give you as far as dollars and cents. The other issue that we're dealing with is what we call the continuity of government operations. And that is, making sure that right now, as we're all having to do things different. I mean, look at how you're doing things differently in your businesses. Look at how things are, going in your home. Well, so too, government has to adapt to that. And so everything from, I mentioned about the licensures and so forth, and doing meetings remotely, but notaries. Everyone here has probably had a document notarized at one time or another, and to have it notarized, you've got to sit there, notary there to observe you sign it. That's not necessarily safe during this time, and it's frankly, it's a little outdated model if you look at how so many things are done through e-commerce now. And so I think you'll see us have some language to modernize that, but in terms of an emergency, but really looking at some changes going forward, recognizing the fact that we now have e-commerce and what we're doing, and making state government keep up with the rest of the world. But everything from, how this is a broad spectrum, like everything from how our prisons operate to, our agriculture, like agriculture inspections and supply chain. I mean, it's a lot of things. And so what you'll see in the legislation we've done is really just a way to change the regulations of government to let it get out of the way of business and individuals as much as possible, but also to make sure that we're maintaining the public safety aspect that needs to be done as well. So with that's the conclusion of the slides, but I thought what I would do is kind of give you an overview of where we are on the money and where things are going forward, and then maybe touch on about where we are as far as the state in terms of the current order we're under right now, the executive order. On the money side, North Carolina received roughly $6 billion total in federal funds from Washington. Now, I always say federal funds, but we know this. Those federal funds in Washington got there because you and I and every other taxpayer paid our taxes and sent our money to Washington. So while it's, quote, federal money, it's also still our money, the taxpayers. But for the purpose of accounting, the purpose of where we are, it is in fact federal dollars that have come back to North Carolina that we have to appropriate. So of that $6 billion, roughly $2 billion of that flowed through and went to various entities, either government agencies or universities, hospitals. I mean, you name it, everything from like homeless shelters to domestic violence. I mean, there's literally hundreds of examples of where that money went. But there was $4 billion that was left for state and local government to be appropriated out. Of that $4 billion, roughly $500 million, about $500 million, was sent to Charlotte, Mecklenburg County, Wake County, and Guilford County. Those four localities received roughly $500 million because they met the metrics in terms of the populations to have those federal dollars flow directly through them instead of through the state legislature. So what that means is there's $3.5 billion. That $3.5 billion is supposed to be used for COVID-19 related expenses or impacts to state and local government, and is to be appropriated by the General Assembly, and it is to be spent. This is the thing. It is to be spent under present law in this calendar year of 2020. So that's, and again, it's all federal funds. So I appointed 4 committees to meet during the last few weeks to really try to get the jump on this, to see what is it that the legislature can do to deal with this COVID-19 crisis that is upon us, and really so that when we come in session, which is we are tomorrow, that we're not coming here beginning the process, but we're coming in with a good grasp of what the issues are and frankly, what some of the solutions should be. We did so in a very bipartisan manner, both in terms of the chairmanships, the committees. Look, I want to be very clear. There's a time and a place for partisan politics, but this is not it. If there were ever a time for all North Carolinians to come together and try to work together for the betterment of this state, surely there's no such time as now. And I mean, there's no greater crisis that we have dealt with as a state in any of our lifetimes. And so we know that this is something that we have to get right. We have to work together, and we have to seek to build consensus. So we have a proposal from the House that is a very robust spending plan of that $3.5 billion that's allocated from the federal government. Now, this is still in the, I won't say it's in the development stages, but for those of you who follow the process here, we have a House, we have a Senate, and we have a governor. And so to get consensus, all three must come together and agree. So right now, what I'm telling you is this is where the House is, but I will say it is in a bipartisan way where these recommendations are. We are looking at an appropriation piece as I'm talking to you now, roughly around $1.7 billion. That 1.7 again is entirely federal funds. There's no state money involved in that, but it goes from everything to stabilizing the schools, putting money in for research and development to our universities, both testing, research, et cetera, you name it there. Stabilizing funds to government agencies, stabilizing funds when it comes to, like, for example, the personal protective equipment, stabilizing our hospitals, as I mentioned earlier. You know, our rural hospitals particularly are being impacted by this, but frankly, all of healthcare is being impacted. You know, our nursing homes, adult care homes, they're facing costs that no one would have projected, and so they have to allow to be compensated for that so that they don't go underwater. All of these are examples of things that we're going to fund through this very robust stimulus plan, taking those federal dollars and utilizing them in the best ways that we can. So if we do that, and let's say we fund it at the 1.7, that will then leave another 1.8 that we can fund in the second batch as well. But that'll go ahead and start getting immediately money out there to help with everything. There's some critical needs out there. We know, for example, it is partially related to COVID-19, and we're seeking guidance on whether we, for example, can use some of these funds to help stabilize the Department of Transportation. We know that our DOT fund balance has fallen into a realm where unless we do something, they will have to essentially shut down doing any operations or anything of any kind of road maintenance, road construction, you name it. And so we can't let that happen. So we have several things in store to deal with that, but that's one where we're seeking guidance on if we can use some of these federal funds to do that as well. But where we are in terms of our COVID committees and in terms of ours as a House is that these bills that are coming out of the committees will be filed tomorrow. They'll be public. We will send those to committee. Some of the committees will meet tomorrow. The others will meet on Wednesday. And then the House will actually take formal action up and vote on these bills as early as Thursday. So that is the plan of moving forward, because we know that we have to get this done. We have to get these funds out there and help where there are critical needs. Since this is a chamber group, I'll tell you a couple things I'm especially proud of. One, we know there's the PPP loan out of the federal government. There's the EIDL loans. And again, those are all outside of what we do. We have no control over those. But we also wanted as a state to try to do something to help as well, to help small business. So we have appropriated in our provision $75 million that would go to the Golden Leaf Foundation to be able to offer low interest loans to small business that will help them as a bridge loan, basically, until they can get sufficient funds through either the federal government or they're able to be back ramped up where they don't need those funds. Because we know the most important thing we can do when it comes to small business, other than the reg reform and those things, or reg relief, excuse me, is taking action to allow liquidity in businesses. So you'll see that as a part of our stabilization package as well. But we're going to vote on those packages, I say Thursday. The hope is the Senate will be in a position to agree to all or most of that, and then get that to the governor to get signed, and then get these funds flowing out there to North Carolinians who need it. What I want folks to know is, as you're on this call, is that we are in a very good position. We are as prepared as any state could possibly be. Before this happened, we had the lowest unemployment that we'd had in decades, the lowest taxes of the lifetime of anyone, certainly on this call or anybody I know. And things were going really well. And then this COVID-19 came around and it just rocked everybody's world. The same things you're dealing with in your businesses, we're all, by the way, I'm a small business owner myself. I'm dealing with there, and of course in state government we're dealing with it. And it has been a challenge that is without parallel in any of our lifetimes. But I mentioned we were in a good position going into this. As I said, the unemployment was low, tax environment was favorable. Businesses were looking to come here and to expand here, so things were great. I've served here since 2002, and during that time, I've seen 2 recessions come and go, right after 9/11, and then of course after 2008, and learned a lot of valuable lessons when I was in the minority about things to do and maybe things not to do. And I resolved, along with others, that whenever I happened to be a member of the party that came to majority, that there will always be rainy days. We've always thought of just economic downturn and natural disasters. I got to say, the pandemic is not one that I was certainly thinking of. But it's here, and we're having to deal with it. We're having to deal with it. But as we went into this year, I want you to see some numbers that should make you feel good about where we are as a state. Back in 2011, whenever I found myself, instead of being on the back row, to being in a position to actually have some influence in how things get done around here, we inherited a situation where we owed the federal government $2.8 billion on the unemployment insurance fund. We were in the hole that much. From then until before this hit, we took that $2.8 billion deficit and turned that into a $3.9 billion surplus. And that wasn't easy. That meant some tough decisions made along the way to make sure that we got our unemployment insurance fund under control and funded in the right way and administered correctly. And so as this crisis hit us, we actually have a surplus. North Carolinians who have unfortunately lost their job can rest easy knowing that the funds are there to provide for them, to take care of them and their families. We also know, of course, the federal government has kicked in $600 as well, and that's a generous amount as well. So while times are tough, at least there is a safety net there to be able to provide for folks. We also have $1.2 billion in our rainy day fund and $2.2 billion on the unappropriated balance. So there you got another $3.4 billion to fund these contingencies that may come up. And for perspective, our state budget is around $24 billion a year. But as we move forward, we've also gotten some of our projections. This was as of last week. The estimates are that our shortfall in revenue, okay, because with businesses being like they are and things now, we know sales tax ain't going to be as high, income tax ain't going to be as high. So we're projecting right now anywhere from a $2.5 to $3 billion shortfall for money that we were expecting. So we have some funds built in to cover that. But again, just it depends on how long and how deep this thing goes on before we'll know what all we have to do. So we're also encouraging the governor's office to look at the agencies and find ways that they can improve efficiencies and see where they can be some modifications made and some reductions in spending as needed to make sure we don't get into a situation where we're in a financial bind. So it's a large, it's a multifaceted issue. We have a number of proposals we're going to roll out. Again, for me to try to go through all those proposals would take up 3 of these calls to do so. But suffice it to say, when you're looking at spending, $1.7 billion, that's a lot of money going to a lot of places. But we have tried to go through in the relatively short amount of time that we've been given to work on this to make sure it's not being wasted and it's actually providing lead on target where the needs are. But again, And I know we're going to have some questions, and I'm glad to answer those as well. But I do want to say that I know the lifeblood and the way that we as a state have done well is, at the end of the day, is not because of great government. It's because of great and resilient business. And you all as business, as the keys who are running business in this state, are critical to how our state got where it is now, and are going to be critical to seeing our state as we move past this. I will say on the, I had a question, I'll go ahead and deal with it, about reopening the state. Where am I in relation to where the governor's executive order is? I will say that when the governor issued his order several weeks ago, based on the modeling and the data that was available then, I think he made the right decision. It was a tough call, but we were seeing modeling predicting thousands of deaths and all these things, and a surge and overwhelming the hospitals. What we've seen is that modeling, the modeling predictions have not happened. Even if you take the modeling that assumed that all of the shelter-in-place guidelines were put in place, those models were showing much worse results than what we're seeing. And so for that, first I'll say thank God that that's been the case. I'm glad things are not as bad as it looked like they might be. But I think what we need to do now, instead of relying on that old modeling, is to look at a lot of the new data we have and then recognize the deficiencies in the testing that's out there to enhance and improve that, so that we get really, literally real-time data to assess this, so that we can start opening our economy back up. Now, I think it would be foolish to simply say, just flip the switch and say, okay, it's over, everybody go back to work 100% the way it was. That's not the responsible way to do it when we know that this virus is still out there. But we can reopen in a responsible manner sooner rather than later. What you do is you make sure that those who are the most in danger, those who are elderly or those with underlying health issues, that they really restrict themselves to where they're going and what they're doing. Second, we know that in the urban areas, that the restrictions that may need to be in place for here in Raleigh or for Durham or Charlotte aren't necessarily the same restrictions that you need in Swan Court or Robbinsville. You got small towns and counties that have zero presence of this virus that could probably go on back, and again, even in a measured way, but start back sooner than the urban areas. So I think a problem with government is government tends to either be yes or no, red or green, off or on. Is a more nuanced approach, the way that we all have to do it in our personal lives and our business lives. So I'm continuing to advocate for that, and that we look for a way to try to really move things up. Right now the talk is that we'll reopen on May 8th, and this is what's called phase 1. But really, there's not much difference between this phase 1, and what we're doing now. So my hope is, and I say these things being careful because I don't ever want to be, accused of being political or partisan and all that kind of stuff, because I think it's absolutely critical that what we do be done in a consensus and bipartisan way. But at the same time, I think it's appropriate that if we disagree with anyone, including the governor, that we express that and we say, why we disagree and maybe how things could be done better. So that when I say this, that's certainly the spirit in which I mean it. But I do think that we ought to look at a way to be a little more robust in that, to look at an earlier time for reopening, but also to establish certain benchmarks. Look to say, okay, what's the rate of hospitalizations across the state? What's the availability of the protective equipment across the state? What are we seeing in terms of the infections? And if you continue to show these numbers that we have right now, where it seems there is sufficient PPE, hospitalizations are low, the fatalities are low, the spread of the virus is low. All of that you can start moving things on, because you can make a strong, rational healthcare argument. Set aside the economic argument, but you can make a strong, rational healthcare argument as to why you'd want to get things moving again. Because, folks putting off medical treatment that's maybe not critical, that's considered, quote, elective, but it's necessary. I mean, everything from colonoscopies, mammograms, you name it, to things that, if you don't get to them and deal with problems now, are going to lead to more serious problems down the road. So there's a compelling argument, even on a healthcare basis, to do those things. So we're going to continue to push that way. We're going to continue to try to do all we can here to get funds where they need to go, to get the policy the right way, and to encourage this state to move forward, so that the great business engine of this state can resume once again, and us get on the other side of this thing. But with that, I appreciate the opportunity to speak, and I'll be glad to answer any questions.
Thank you, Speaker Moore. It was a very enlightening presentation, and certainly appreciate you going through the specifics. I also appreciate the reference to the bipartisan efforts. Obviously, we are primarily North Carolinians and Americans in the midst of this healthcare crisis and the related economic crisis. So now is the time to be united. With respect to timing of the first 1.7 billion, you spoke to some specifics. Obviously, there's the House plan, the Senate plan, and the governor's plan, but your outline of sort of projected timing from your perspective, the bills will be dropped tomorrow and potentially voted on as early as Thursday. I guess two-part question here. First is, do you feel pretty good about that timing? Obviously, you guys have been coordinating. And then secondly, do you have recommendations for where people can get specifics to each of those plans as the bills come out tomorrow?
Certainly, the bills will be loaded up on the website, ncledge.gov. They'll be loaded up and folks can see those. There should be staff summaries that'll take those hundreds of pages of bills and put it into something that's more easily digestible, an executive summary, if you will. Those will be available. In terms of the process, how hopeful am I that we'll stay on target for that? Honestly, it just depends. This is still there are parts that have been pre-negotiated with the governor's office, with the Senate, and then there are parts that have not. And really, I think that in the House, we've had the benefit of we've already had our committees now working for several weeks, hearing from stakeholders, having public meetings, really getting a lot of input, doing a lot of deep dives into what the issues are. And so I think that we've got a head start over a lot of other folks just because we've been here and been working on this. When I say we've been here, the meetings have been done remotely just as we're meeting right now. But we've been working on this, and we have, for those who follow politics, you have the committee process, and sometimes you wonder how much of it's for real, how much of it's for show, right? What I can tell you is in the committee process that we have had this entire time, it has been real committee process. It's been everyone working together, collaborating, getting that information out there, debating it in a public way. I mean, there's no way for folks to really be having a lot of one-off conversations. I mean, it's a unique opportunity where citizens of this state are able to see exactly, as the old saying goes, how the sausage is made, how legislators are coming up with the compromise and discussion on these issues. And so it's been a way that we've done that. And I think folks, if they want to monitor this, will see it, and they'll be able to see exactly how this thing develops through the two chambers.
Great. Thank you. The only other question I had, and I know there were lots of other questions that were sent in, and Sarita is going to take over and bring some of those questions forward. But the other question I had, it strikes me as being very prudent to take the netted out 3.5 billion in remaining funds for appropriation, and knowing the speed with which things have to get pushed out, to do it in two parts seems wise to me, because we know it won't be perfect because things have to get done quickly. But what does the timeline and process look like for that second batch that you referred to, the 1.8 billion? What does that play out like?
At this point, I don't know, and that's just it. We don't know what other shoes are going to drop. We don't know if this thing, within a few weeks we can start getting back to normal. We don't know. We don't know if this thing's going to come back around in the fall. We need to be planning for those things. We certainly should not get caught flat-footed on this thing in the fall, because we know the way viruses work. We know the way the flu works. It comes, and then the next year there's a different season. And what it is it's a different strain. It's a lot of unknowns. We don't know, for example, if you develop an immunity to the corona or to the COVID-19, is that something that would help you if it came back later in the fall or something? We don't know if that's think of like the chicken pox, right? Once you get it, you got it, you're done. But the flu, you can get it every year. I mean, it seems to be more like a flu strain so that you could get reinfected again in the fall. But there's nobody really knows. I mean, this is a brand new virus. So we don't know what some of the costs are going to be. Look, we are planning at this point that come fall of next year, kids will be back in school, folks will be back in the colleges and the community colleges. You know, if we have another one of these outbreaks, say it was worse, I don't know. If that happens, we need to have a plan in place so that we can adapt to it. We can switch to the distance learning and those type things. So that's going to require some technological improvements that we're looking at funding as well. But there are just so many unknowns, and so I think it's important that we, you know, that we assess. So, you know, if it was to say, well, yeah, we're looking at coming back and doing this second thing in the fall, and I know there's a few things that I just can't remember, you know, around this call right this minute. But for the most part, it's really making sure we have the funds for those unknown unknowns, as Donald Rumsfeld so eloquently said that time he testified before Congress.
Certainly makes a lot of sense. Well, at this point, I'll let Sarita bring forward some of the other pre-submitted questions that she has.
I heard she's a tough questioner too, so I'm ready.
Thank you, Mike. Speaker Moore, the next question is, our state's universities are the future talent pipeline for many businesses. How do we resume learning at the university level?
That's the $1 million question, isn't it? So I think a couple of things. Number one, we continue to invest in online education. So much of the business world is now online based. So much of our personal lives are online based, and it should be actually easier to do things online, particularly for college and community college. You don't have near the challenges there as you do, say, for K-12. And I mean, think about, you know, the age of kids and all that kind of stuff. So I think we continue to invest in online education, but also understand that we need to provide for that critical college education. But I'm going to tell you, we are very, very fortunate that with the amazing universities that we have in this state, both public and private, that we are, from a research standpoint, from a treatment standpoint on COVID-19. I mean, think about it. There's been stories talking about how the studies at Duke, the studies at Chapel Hill, and the work of Dr. Barrick there, you know, developing a vaccine and an effective treatment. And then, of course, Wake Forest doing doing a number of things, the animal testing, and then as well as the additional testing for the antibodies. There are some absolutely amazing links out there showing how our public and our private institutions of higher education have put North Carolina not just at the top of the heap nationally, but really on the world stage, critical. And I think we need to continue to make sure we're investing there. And one thing in our budget, a provision that I actually was insisting on having there was an appropriation right now at $110 million for those for the medical schools and schools of public health to get those funds out there, both in terms of the research and the efficacy of treatment, particularly in the rural areas. But you're going to see us continue to invest in our universities because they are among the best in the world, and something we can be very proud of.
The next question is, with so much unemployment and so much health insurance tied to unemployment, what do you see as the path for ensuring health care?
So, you know, right now, whether you have insurance or not, if you show up at an emergency room or at a facility needing medical treatment, you're going to get it. You're going to get it in North Carolina. We know that COVID-19 has brought on something unprecedented, and I support modifying the Medicaid eligibility rules to make sure that those who would not necessarily be entitled to Medicaid under current law can get it with respect to the testing and treatment of COVID-19. We know the manner in which it spreads. We know the way it works. And we know that that's critical to get to the source and make sure we're providing that treatment. So we're going to continue to do that. Of course, we're going to continue to invest in ensuring access to quality health care throughout North Carolina. We know conversation often is around the lines of payer mix and all that sort of thing. But we also know availability. I mean, we have areas of this state whose hospitals hang in the balance even before COVID-19. And we know that we're going to have to find ways to stabilize those hospitals, to make sure that they're okay, because you live in certain areas of the state. The last thing you're worried about when something's happening is who's going to pay for it. You want to make sure you can actually get to a hospital and survive a heart attack or whatever the issue is. So we're going to continue to invest there, and we're going to make sure that when it comes to the funding for everything from nursing homes, adult care homes, hospitals, and individuals on COVID-19 treatment, that there are ample resources out there to take care of this.
The next question is, what can local chambers do to support our businesses and get them off to a fast start with recovery?
You know, chambers do an amazing job. I'm a member of my local chamber back in Cleveland County, and really highlighting and promoting among the members using utilizing that resource, making sure if you've got local businesses that are struggling or providing services, getting the word out. Frankly, I think a lot of the initiative I've seen of encouraging folks to go and do carry out options with these restaurants is key. I mean, I've tried to do that. You can't fully see, but you could see well. You can see I don't miss many meals, so I eat out a lot because I can't cook well. So I have become the king of carry out here of late, and I think chambers can continue to get the word out and provide a resource and a platform to make sure these businesses know that. But I think also, lobbying and effectively getting the word out about your members and what the needs are. I'll give you an example that came from the restaurant lodging folks and also some of the local chambers. Right now, if you go to a restaurant that serves mixed drinks, mixed alcohol drinks, they just can't serve you at all because they don't have dine-in. We've got a provision in here to relax the rules so that they can serve mixed drinks to go. By the way, don't drink and drive. That has not been suspended, okay? But that you can take those with you as you go enjoy your carry out somewhere else. That's just one little example. But I think making sure that a mom and pop store or restaurant can't go out and have their own lobbying group or whatever, but collectively small businesses can work together and make sure that through chambers and other organizations they can get their voice heard. So that's a key part.
The next question is, what ways can cities help move the state forward from COVID? And how do you anticipate the state can help cities?
Did you say cities?
Yes, sir.
Towns and cities. Okay, sorry, it broke. Okay, so, well, of course, cities can do a number of things. Number one is when it comes to building permits, these regulations like that, extend these things. Work with folks. Try to find a way to say yes and help people and not put barriers in place when businesses are already dealing with so many things when they need help from cities. That's sort of an easy one that doesn't really even cost anything. Cities and counties are going to get money, by the way, through this funding as well, because they're going to have shortfalls themselves on their budgets, and they're going to be critical to knowing what the needs are. So I think you'll see when it comes to cities and counties that we provide funds there. But I'll tell you the other thing. I do believe that when it comes to a lot of about the reopening and when and some of the parameters, I honestly believe, as I alluded to earlier, that it's not necessarily a one size fits all. That it would be appropriate to give counties more flexibility, and when counties can go. But if you have a county that say has 0 incidents of COVID-19, you have sufficient supply of PPE, you have access, you have all these things, then perhaps that county, that rural county that has no cases, can go ahead and start opening and doing things that would not be appropriate to do in Mecklenburg County or Wake County. So I think that local, not just cities, but I think local government could be a key part when it comes to those kinds of issues.
The next question is, in navigating the balance between protecting people's health and our economy, could reopening too fast create more issues?
Certainly, if you were to just reopen too fast, if you were just tomorrow to say, you know what, we're done with this, we're going to just go back to 100%, I don't think that would really be safe, because there's data out there that shows that if you just throw everybody together and you don't have the precautions in place, like the distancing and those kinds of things, that you could have some issues. I mean, look, if you look at where the spread of the virus is, it's in urban areas where folks are packed tightly together, or it's in closed communities, things like nursing homes or prisons, where folks are in very close proximity. I mean, this is a respiratory disease. So it sounds like it's like basically the aerosolization of bodily fluids that are then inhaled, or you touch something and you touch your eye, you touch your nose or mouth, and it can get in that way. That's where the problem is. So we now know enough. We know enough things about this that we have some ideas of what are things we can do to be safe. What are the conditions that make it unsafe? So is there a way of going too fast? Absolutely. But is there a risk in going too slow and creating all sorts of other problems? Absolutely. And the key is to strike that balance. But again, how you know you're striking that balance is not to rely on modeling data from a couple of months ago that frankly has been inaccurate, okay, is not panning out the way it predicted, and use more current testing and more updated modeling that shows you can do some things. I mean, look, states around us are moving ahead and opening up sooner than we are. But again, opening up with reasonable restrictions in place. I mean, South Carolina, Georgia, Texas, Tennessee, a number of states in our immediate proximity are reopening for business sooner than we are. So my hope is that the governor will take a look at some of this data and consider really, moving things forward in a little more robust manner in terms of sooner, and in a nuanced manner where you give the county some flexibility as well.
You mentioned businesses that sell alcoholic beverages. When will bars be able to reopen, and with what requirements?
Under the executive order, it's not clear, because they're really, the only firm date that was provided was the May 8th for this phase 1. And under the phase 1, it was, I believe the governor said, reopen there and then look to 2 to 3 weeks later to going back and partial reopening of restaurants and like under 50% occupancy, which, by the way, it's good to have a partial thing. I just think it should be more on the front end instead of that far out. But if you try to parse through the information that the governor shared in his press conference, I mean, you could be talking about June before any of this happens. And so that means going through the entire month of May. And I think that's going to be tough for a lot of these businesses to survive that.
Speaker, this is the last question. What is the most important thing you want us to know about COVID-19 and its impact on NC's economy?
Well, wow, it gets worse every day. But among all of the bad data that's out there floating around, I think North Carolinians can take a lot of comfort in knowing that as we went into this, North Carolina was in great economic shape. If you look at some of the other states, you look at New York, you look at Illinois, you have a lot of other states that were already and had structural deficits and real problems with their budget. North Carolina actually had a surplus. So North Carolina is going to come out of this, I would predict, economically sooner and stronger than a lot of other areas. And I think it's good policies that this General Assembly has put in place that have helped. But at the end of the day, it's the Tar Heel spirit of strong businesses, strong free market economy, making sure that we've been through tough times and that we do all we can as a state to get past it. And so I predict that just the same ingredients that had North Carolina as the top place to do business in the country before this pandemic hit, that it will be that same environment that allows us to get through this, and we will get through it. I mean, these are some tough days. These are some tough times, but we'll get through it. We'll be stronger on the other side. There'll be a lot of things that we do different, but definitely brighter days are ahead. And if we all work together, we'll get there.
Thank you so much, Speaker Moore. I'd now like to turn it over to John.
Well, actually, Sarita, this is Mike. I think I'm going to wrap it up here just before 3. Thank you to John Goodman, to Sarita, and to the Chamber staff for pulling this together. And Speaker Moore, we are especially thankful to you. You are a day before quite a hectic session here, and so we're so thankful you're willing to carve out some time and give it to us here in the Raleigh Chamber and update us on all the happenings. We thank you for not only that time today, but we also thank you for your commitment and service to this state. for at least the past 18 years. As you mentioned, we're as positioned as well as any state can be and any local region can be coming into this thing. And just like you referenced, I know our adaptability and tenacity as North Carolinians are going to help us be poised for even greater continued success on the backside of this. So thank you, Speaker Moore. And with this, we'll be adjourned. Take care, everyone.